My name is Jennifer Andrus, and I am the mother of two boys, both with profound hearing loss. And our story actually began when my first son was 11 months old in 2004, and I was pregnant with my second son. Our first son, unbeknownst to us, had gone obviously through a newborn hearing screen at St. Vincent's in Birmingham and had passed. And so we had no idea that anything was wrong with his hearing. And at 11 months old, we went into Children's for him to get tubes. And there was an audiology screen that is automatically done. Again, we didn't even know that. And we were blown away to discover that he had, I believe at the time, it was mild to moderate hearing loss, and that he would need hearing aids. And insurance was going to cover them, and we were in shock. And, we were like, we're just here to get tubes. I mean, I don't know who you think you're talking to, but we're just here to get tubes, So we ended up seeing a geneticist, and some blood was drawn when he had his tubes put in, and sure enough, John was positive for the Connexin 26 gene mutation, which means that the hair cells in his cochlea were not working properly or damaged and not carrying the sound waves to the auditory nerve. So he was fit immediately for hearing aids. Of course, I was also 11 months pregnant, or not 11 months, I was actually, he was 11 months. I was actually, at that time, Will was due in September, so I was actually far enough along in my pregnancy, 20 weeks is how far I was. So we knew we had a chance, this is a recessive gene, that Will was also going to be born with the hearing loss. And he was born in September, and the nurse took him back, and we did know at this time that he was going back. And she kept him for a long time, and she brought him back, and she said, well, I'm going to come back and get him again. We're going to try again. It was real loud in there. There are a lot of doctors in there. And my kids are fine, I promise. I just get emotional thinking about it. But anyway, she tried several times. It was very sweet of her, but we knew. We knew that he was going to be deaf. And so we hooked up right away with our audiologist at the Hear Center, who had taken such great care of us with John. And we began our testing with him then, right then and there. I mean, he was 2 weeks old. I literally had gone to the hospital to have my stitches taken out from my C-section and took him straight to Children's to see Heather immediately. That's how early on in the process it was. And so he went through a series of ABRs with her, and sure enough, he was profoundly deaf. So we immediately got in the queue, meaning we immediately got into the process of getting approved to, as soon as he was old enough, that they would do the cochlear implant surgery. So he was implanted when he was 10 months old. And we started speech therapy even before that. And he had hearing aids. No, they didn't do much good. But we started with the speech therapy before that. And we went every week, at least once a week. He got into some wonderful programs through the Hear Center. And he was implanted with his second implant before his second birthday. And he is a happy first grader who is so brilliant. He knows every president. He knows out of order, in order. You can ask who the 25th president is. He knows. You can ask who the 16th president or the 5th or the whoever, and he knows. He knows every teacher at his school, first and last name. But I will tell you that the spring before he started kindergarten, that was about a year and a half ago, was his IEP, and that was the first time that he actually tested at the level of his peers. So it was all that work. In that early intervention at that age, and all that work for all those years, and he finally caught up. And he's brilliant. I mean, he's such a smart kid. So it wasn't his intellect, it was his speech. And so John, just a quick little footnote to John. John, his hearing ended up actually dropping out the summer before his first grade year. And so he was going to have cochlear implants too. And we knew he'd be fine. We knew he'd do great. And they're great, happy, wonderful kids. There they are right there. Look at them. They're great. And John is, again, very smart and reads. He's reading both first two Harry Potter books right now. He's almost finished with both of them. He's 8. But anyway, he ended up getting cochlear implants right as first grade was starting. And his teacher, just through, I think, divine intervention, but his teacher is actually a mom of a baby with cochlear implants also. That was in first grade. And her baby was actually one of my children that I volunteered for at the Bell Center in Birmingham. But anyway, John was implanted, and he was the first kid in Alabama to be implanted with a Nucleus 5. And we did a little bit of speech therapy, not much, and he just took off, and they're doing great. But the point is, early intervention and the care, of everyone that's taking such good care of us, like I said, we didn't even know what was going on. We didn't even know John was tested when he was born, and in the journey we've come through to now. So anyway, I hope any of that made sense, but I'm happy for questions when we get to that part. But thanks, y'all. Appreciate it. There they are.
Hi, I'm Gabriel Bassett. This
And
is
I'm
my wife,
Tabitha Bassett.
For a lot of people, it seems like the newborn screening is one of those things that allows them to get into treatment as quickly as possible for something that's going to be a lifelong issue for their children. For us, the newborn screening immediately stopped ongoing damage to our child. So let's start. I mean, he's come through a couple of times, but
Yeah.
Oliver is our favorite mutant. He has galactosemia. It's a genetic disorder that prevents him from breaking down some of the areas.
Yeah, the simple sugar galactose, a simple enzyme that he's missing.
And is something that shows up a whole lot in milk, which is something babies get a lot of. And this ended up being a very big problem for us. When we left the hospital, things seemed absolutely normal. The pregnancy was normal. Delivery went normal.
Well, slightly normal. I ended up with a C-section after 18 and a half hours of labor, let me tell you. And I'm an RN. I'm an RN. I work in the neonatal nursery at Crestwood. I understand this. I understood we were going to have a newborn screening before we left the hospital. His bilirubin was 9.6. PKU draw was great. I knew the nurses that was drawing. And I knew that it was going to come back.
Yeah.
Well, it came back at 10 days old. He was already, Thursday, we went home on Wednesday. Thursday, we started home phototherapy that afternoon because his bilirubin had jumped from 9.6 from Tuesday night to 15 on Thursday. Well, you understand, yes, Billy peaks at about 8 days. We understand that. As nurses, we understand that. So I was like, home phototherapy, not a big deal. The next morning, instead of going down, it had jumped up to about 17. Well, about 3 or 4 o'clock in the morning, he was crying. And, of course, we had to have the home phototherapy in his bed, in his crib. So I had to go from our room into there. He had vomited. It looked like he had vomited up blood. I was like, oh, Lord. So we were up all morning. As soon as the pediatrician's office opened, we went in there. She's like, we're going to have to admit you. We did phototherapy in Huntsville Hospital on the pediatric unit, and it was fine. We went home the next day. His billy had dropped down to 11. He still looked like he was a little bit green, from the residual bilirubin on his skin. But, otherwise, there he is. That was right when he was born, or after he was born, when he come to the room, of course. And then...
from there, things just got worse. We had our grandparents over visiting, and he's limp. You pick his arm up, and it just drops by his side.
It went from being that kind of green to gray.
And
tone was so poor. And I'm like, oh no. And I told Gabe, I said, call a pediatrician, tell her what's going on, which I knew we were going back to the pediatric ER. I knew it. We got there. And of course, she said, go to the ER. We got there. We had a team waiting for us. They knew a 6-day-old was coming in. They were great. They worked like a team. We had sticks in one arm, sticks in the other, doing a cath, pulling levels. His liver enzymes were through the roof, over in the thousands. They were bad.
And so, they got him stabilized, put him in the PICU.
Yeah, we went to the PICU.
Put him in the PICU, and we went home. That was, I think, a Saturday night, thinking that things were kind of stable. And so next Sunday on our way to church, we got a call from the nurse, and they say the doctor needs permission to give him blood products and needs it now. Said, well, we're on our way to church. Can we do this after? And they said, no, it needs to be now. I said, by the way, you need to come in. Your son could die in half an hour. His liver levels are so bad. He could bleed out internally, and there'd be nothing we could do. And that just started the worst day of our lives. And from there, no one had any idea. They brought in every specialist that was available. Everyone looked at him. They tried everything they could with him, and nothing fit. Nothing worked.
He was on acyclovir. They pumped him. They were like, "Are you sure you weren't HSV positive?" I said, "I am positive. No, it's not HSV." They were thinking that he was septic. We're like, "He's not septic. It's not an infection." But they did everything they could, and he wasn't getting better. His PT and PTT were through the roof. Because his liver wasn't functioning, he wasn't clotting like he was supposed to. He never looked as sick as his levels did. But, because he was awake and, he would wake up and he would respond to you, and he'd open his eyes and look around. And through all of this, I was breastfeeding, of course. We were like, breastfeeding, go breastfeeding. Okay. I was breastfeeding.
We'd have a good day and a bad day. Things would be getting better, and then things would be getting worse. And it just cycled like this for about a week. And we moved back onto the
pediatric unit because he wasn't sick enough to be in the PICU. He was stable. He never had any cardiac issues. He never had any respiratory issues.
And so we're sitting there and feeding him, literally feeding him there. And we get a call that comes through from our pediatrician. And he says, he doesn't even, start with the formalities. He says, is Oliver feeding? I said, yeah. He said, stop right now. We just got initial results back from the newborn screening, and he's positive for galactosemia. You're basically poisoning him every time you feed him. So what was happening was every day that he had a good day, he would start eating again. Yeah. And then everything he ate poisoned him, and the next day was bad again. Day.
So we would have this, he would start to perk up. And we didn't really pay attention to it. We had gastroenterologists, we had cardiologists, we had everything. I have a family history of hemophilia. Hemophilia runs in my family. It runs on my mom's side of the family. Women are carriers. We understand this.
Neither of us were aware that we had this recessive gene. And this is a 1 in 60,000 case. This is not what the doctors were looking for. Yeah. And without the newborn screening, we would have continued to have poisoned our son. And with it, that exact second when we took that bottle out of his mouth by getting the screening back was the exact second things started to get better. Yeah. No more milk from then on. It was all soy-based formula. Mm-hmm. He started to get progressively better. His levels went down. He moved to the NICU
at Children's Hospital. Yeah, it's an open NICU. So he was on contact isolation for about 3-4 days. We had to wear PPE and everything like that. That was really hard for my parents and everybody. Through all of this, I was pretty comfortable because I'm used to seeing at Crestwood, we're a level 2 NICU, so I see IVs and oxy hoods, and I see not extremely sick babies like our Huntsville Hospital nurse over here. They have the regional NICU. When we have those, we send those down the road. But I was pretty comfortable seeing the baby with an IV. The only thing was when we got to Children's, they did a central line in his EJ, and I was like, whoa, that's something new, but I was still comfortable with it. My parents, on the other hand, were very I don't know if they wanted to hold him, and they eventually did.
But ultimately from there, things got better. It was that exact point when we got that initial result back, and from there, the doctors were pointing in the right direction. UAB has the specialists on this. We knew how to treat him. We knew what to do. We could do the additional testing, the genetic testing, to figure out exactly what the issue was. Mm-hmm. And now, from here on out, it's just diet. He gets a specific diet, and he's fine. That was all it was.
For the most part. He's at risk for developmental delays, learning disabilities. We have to go and see an ophthalmologist every 6 months to make sure he's not having any cataract formation, especially being an infant. But otherwise, he's really smart. He's 10 months old now. He's walking about 5 and 6 steps. He's getting there, though. He's going to take off anytime soon. We know this. He says, Mama and Daddy, and he's trying to say cat, and there they are, playing in the yard. He's a lovely little boy. He's so smart.
And it was the second, literally the second we found out about the newborn screening results that changed everything. So.
But it took 10 days. 10 days for us to get this back. Normally, with galactosemic children, they go home, they're not eating well, failure to thrive. They normally don't get that sick that fast. But it did. And he could have died. And we're lucky.
That's our story.
Hi, I'm Malcolm Branch. This is my wife Janet. We're the parents of Sarah and Emily Branch, and they have MCAD. And we've been seeing Dr. Rutledge at Children's Hospital over there, and she's been great.
Yep.
You want
Um, our second child was the first one that was diagnosed with it, actually. And that is because about 2 weeks before she was born, they had expanded the newborn screening to include MCAD.
When Sarah was born, we did not know that anything was wrong. It wasn't until Emily was born, and I think Dr. Rutledge had told us that we were probably one of the first people in the state to get picked up on the screening. And that was a very, very unpleasant phone call. We got a phone call at like 8:30 at night from our pediatrician saying, you need to bring the girls into the office right now. And we're like, well, why do we want to do that? She said, well, we can't talk about it over the phone. You just need to come into the office.
Yeah, they said, don't get on the internet. Do not look anything up.
So that was not a very fun time. But we have since found that, due to the screening, both of our girls are fine. They're developmentally normal. They're wide open little girls. Had it not been for the screening, they might not be here now, because we had no idea there was anything wrong when Sarah was born. It wasn't until Emily that we found out, and the doctors told us that if this one's got it, then the other one probably has it too. And
Well, we had, a 25% chance that she had it, and
she does.
Did. It's recessive.
They both have it. So
we had no idea that we either one had the recessive gene.
No, and it's affected our lives in that pretty much any time they get sick, it's straight to the hospital if they can't keep food down. And we've gotten a lot of good advice from the folks at Children's, and we've really had no problems dealing with it. I mean, it's pretty apparent when they're going to have a problem with it. They can't keep anything in. It's straight to the hospital and get an IV. Early on, it was kind of tough getting them to take the snack before bed with the cornstarch in it and all the things that they were telling us to do, because they were little and they just didn't want to cooperate, which is still the case a lot of times. But now they know that when they're sick, they have to try and eat. And just using those things that they've told us, we've stayed out of trouble with it. But had it not been for the screening, we would not have had a clue. There was just no sign whatsoever that there was anything wrong with either one of them.
Yeah, I think most of the cases of MCAD before the expanded screening had been, they found it in the autopsy. And
yeah, that was
that's not us.
That wasn't a good phone call to get. I mean, we were told it's almost always fatal, undiagnosed. But with the knowledge,
might be 10 years, might be 20 years before it's fatal. You don't know, but it's just that one time that they're sick and a little bit too long.
Like we've been told, you have to overreact every time, and as long as you do that, you'll be okay. And we've done that every time, and we've been fine so far.
Yeah, we plan on overreacting for many years to come.
Yeah. So we're definitely big proponents of the screening because, like I said, they probably wouldn't be here now if it wasn't for that screening. So it was not good news to us. It was not the sort of phone call you want to get, but it possibly saved their lives, or it almost certainly saved their lives, really. So, yep. Thank you.
I'm Daniel Marvin. This is my wife, Amy. You'll see our little boy up there. His name is William. He has PKU, which is phenylketonuria. Amy and I are both healthcare providers. She's an RN, and I'm a nurse practitioner. And big thing in all this is it's kind of interesting to hear people's initial emotions. It's kind of been at the same point that we were, was that, you know, these are some things that you don't ever expect in a million years, and you can't plan for it. And to hear some other people, it's kind of, you know, made it kind of come back to me is like, you know, there's other people that have experienced it, and there's going to continue to be people that experience. And as healthcare providers, you can really, you know, make a point to kind of be educated about these things, to be there for the families when they go through this initial diagnosis period, which, you know, for Amy and I, you know, we had no clue as to anything that was wrong at all. I mean, we have an older son, Michael, who is 9, and normal pregnancy, normal everything, perfectly normal kid, newborn screen negative. And being healthcare providers, you know about newborn screening, but you really don't understand it because it really doesn't affect you in many ways. You know, you just hear about other people's children that come up with a positive test, and, you know, being in the ER, you know, we get the children at Children's with, you know, metabolic disorders that are much more life-threatening in acute illness than PKU. PKU is kind of more of, you know, you have to adjust when they're sick, but there's not the life-threatening crisis. For instance, in maple syrup urine disease and galactosemia and some other things. So it's one of those things where we're fortunate in some ways that it's just PKU, but at the same time there's the daily grind of doing it. But I think the biggest thing and for us is just just totally being blindsided out of nowhere, and just, you know, the feelings that go along with, you know, normal pregnancy. I think they've mentioned it here before too, but, you know, normal pregnancy, everything's fine, normal delivery, and normal, you know, normal, you know, two-night hospital stay. And I recall with all my children kind of being there for their heel prick, you know, to fill out that little card, the little dots on that card, and I specifically remember for all my children, it's now specifically with Will, you know, and them doing that, because now we do that. Still, at 7 years of age, we still fill out that little card every 2 weeks or a month, depending on how good we are. Dr. Rutledge, you didn't hear that. But you know, and just to kind of go back to that time period where everything was fine, and you know, you see that newborn screening card and it's gone, and you're like, okay, it's gone. It's going to be normal. And then, you know, 2 days later, you get a call from your pediatrician going, you know, Richard Stone and Vestaya Pease, you know, I kind of like to say that I helped train a lot of the residents around there, but he's a good friend of mine through his residency, and he said, man, we got an abnormal newborn screen. And
tell this part?
Yes, go.
Sorry, I want to talk a little bit. I was going to tell this part. We went home with Will, as he said. Everything was great, perfect, little family of 4, and it was actually at 8 days of age that Richard called and said we had we needed to come back in, that we needed to repeat the newborn screening. And it was really interesting. Michael, who is our oldest, has absolutely nothing wrong genetically, but he had a false positive on his thyroid. And that was my first baby, and I did get on the internet like you're not supposed to, and got all over it and was all convinced that he was going to have this horrible problem with his thyroid. And then I went in and they redid it, and Richard's like, look, we get false positives on this all the time. This is no big deal. I want you to just go home. So when he called me this time, I thought, oh, okay, we have another false positive. No big deal. The only thing that kind of made me think twice is he said, can you get here now? Like, it's 4:30. Can you get here before the office closes? And I was like, well, yeah, we're 5 minutes away. And that kind of started me thinking maybe this was a little bit different. And then when I got there, the nurses came in to draw the blood, and they were really funny acting, like there was something really wrong with me, and they were tiptoeing around me, and I was starting to get a little freaked out. And So I finally asked, we were fixing to leave, they'd drawn the blood, and I said, can I talk to Richard Stone, please? And he came in, and I was like, all right, what's the deal? People are acting really funny. How is this different than last time? And he said, last time you had a false positive on your thyroid, and that happens all the time. Will has a positive on his the PKU part of the test, and I've never seen that. He goes, I don't know if that happens, if they get false positives or not. I just know I've never had it happen. So it's a little bit different. So we went home, and they overnighted that, and we had the results the next day that it was again positive, and that's when they told me, hey, don't feed your baby anymore. You have an appointment at 4 o'clock at Sparks Clinic with Dr. Rutledge. And, like, if he gets hungry, and they were like, you can give him Gatorade. And I remember thinking, Gatorade? Do you want me to give this precious little 9-day-old baby Gatorade? But anyway, one thing I did want to point out about that, just I am a nurse, and I know a lot of y'all are nurses, is just the fear I felt because nobody was talking to me at the pediatrician's office. But you still pick up on something's going on. That was just kind of an experience that I think back on. And another thing, when our third child was born, you're very hyper aware at that point about the newborn screening and how important it is. And I remember the nurse saying when they came to draw the blood, it actually might not have been Luke. It may have been a friend's baby. They came to draw the blood, and they were like, what are you doing? And she said, oh, it's the PKU test. It's no big deal. Nothing. It's just something you have to do. Nobody ever has this. And my friend and I kind of laughed because we were like, well, actually, sometimes they do. So just not to minimize, because it really is an important test. After we found out that Will had PKU, we kind of started digging into our family history a little bit because we didn't know we were carriers. And a lot of times you can't find anything, but the unique thing about Daniel and I is we actually both do have relatives that we can find way back on our family tree that have PKU. I have a second, third, I don't know, one of those distant cousins who's my age that has it. So he was also on diet and is healthy and normally developed. But Daniel has a distant relative that was born about 5 years before they started doing newborn screening in that state. And she has lived her entire life in an institution. She doesn't speak, and she doesn't walk, and she spends a lot of her days in restraints. She's very combative. And I just look at that picture and think it's just a miracle to me what a little drop of blood, how that can change your life. Because Will's been going by here too, and you can see he's one thing Daniel said one time, we were talking to some really freaked out new parents, and we had all 3 of our boys, and you can't pick out which one of them. It's kind of reassuring to new parents to say you can't tell. They're all developing just as equally. But
Right.
Anything else?
Nope.
Okay.
Thanks.
Good morning. My name is John Smith. That's my wife, Jenny, and that's my son, Ethan. Our son is diagnosed with cystic fibrosis. Basically, we didn't know anything about CF before we were told that, hey, those 5 drops of blood on that screen you had to do. Well, one of them is for CF, so you need to go up to Birmingham and test it out. Like I said, prior to that, we didn't know anything, but the experience that we had when we were told from our local pediatrician was not to hurry up and get here or anything like that. I do wish that we were told not to look anything up on the internet. That probably would have helped us a lot, because I pretty much broke down and cried at work. It's not a lot of reassuring stuff for people who's had CF for a while, but we were thankful, though, that we were able to find out within that first month that we did need to find out for sure if he had CF. So we went up to Birmingham and did a sweat test. That's one of the secondary tests to confirm the blood test for the newborn screening. And it tested out positive. I'm not absolutely sure how long the time period was between when we did the test to when we were told, but pretty much they told us over the phone, we're sorry. It did come out positive, but there's so many great things happening, in the field of research, and compared to just 10 years ago, things are different. So don't get too down. Just come back here, and we'll talk about it. We weren't aware, and we still are not aware of anybody in our family who's had CF. There's no distant cousins or on either sides of our family, so it's always just that combination of the man and the woman, and even between there, the percentage of how someone's going to end up with CF is so small that I guess our families just happen not to find their spouse to have a kid with that CF. So we feel good about everything that we've been going through. The thing that I've heard a lot of everybody else say is the early stages, attacking the disorder is really the key. I can't imagine how anybody in years past who maybe their kid was 2, 3, 4 years old and they didn't have a diagnosis yet, how the rest of their life was turning out. But much like with them, you got 3, you can't pick out who has what. It's the same thing with Ethan. Nobody can really look at him and go, I think there's something going on there. He may not be the fattest kid around, but he definitely comes about as normal as can be, and that's probably one of the biggest things. Like, my wife's had to stay at home because our doctor at a children's hospital in Birmingham told us if it is at all possible financially, if you can, have one person stay home so Ethan doesn't have to go to daycare. We really encourage that. So God's taking care of that, and He's got His hand on the situation. We feel reassured about that. Everything has worked out, and like I said, she stayed at home, so she may not be getting paid, but I consider that a home nurse. She is up on everything. She educates me all the time. We have a medicine box, just like I'm sure most people do, of all the things that the doctors tell you, and you follow it to the T, and that's your kid. So if it's you, it's like, well, if I have a cold for a while, I'm not going to worry too much about it. But if my kid has anything that needs to be done to them, it's going to happen right there. I don't care how inconvenient it is. So we're glad to do it for him. The CF apparently comes in a couple of variations. He has the Delta 508, which is, from what I've been explained, the most common kind. So it has an impact on his lungs, which is something that we're taking medications, and we're doing chest physical therapies to try to minimize that for the rest of his life. And also it affects his digestive enzymes. So that's why I kind of made the joke about him maybe not being the fattest, but compared to a lot of kids, he's not that much skinnier. Like I said, we're extremely thankful that the newborn screening was available. We do wish, though, that they probably could have called us in to kind of talk to us face to face, because we were told over the phone that it was possibly CF. So I probably would have appreciated maybe our local pediatrician to kind of give us a brief before we're going to Birmingham, so I didn't freak myself out. But that's pretty much about everything. Thank you.